Hey guys, Dr. David Lim, board certified laser dermatologist. Today's topic is a really broad topic, and that's how to treat pigmentation. It's a really broad topic because pigmentation can be due to many different causes and in different locations. So today we're just been concentrating on facial pigmentation, the causes of facial pigmentation and how to treat. This lecture in itself will take normally about an hour, at least an hour, hour and a half to do, but it's going to be a 10-minute lecture and it's going to be a broad-based topic, okay? So the most important aspect of treating facial pigmentation is identifying the cause. If you want some home remedies, I've done that video already. Today is basically how specialists like myself and fellow dermatologists treat facial pigmentation. And this is our mindset and how we actually think in regards to facial pigmentation. The first and foremost, it's a diagnosis. What is the cause? If you don't have the cause of facial pigmentation, you will not find a solution. So for us, it's always about finding the diagnosis. And the most common case of facial pigmentation, which I see on a day-to-day basis, realistically, no kidding, probably about 6 cases a day, is melasma. So melasma basically is due to several factors, including hormones, UV exposure, and most importantly, genetics. And it presents in a certain way. It presents as patchy areas of pigmentation involving most commonly the upper lip. It also involves the area of the forehead and around the eye area, but most importantly, it's usually sparing just below the eye, about a centimeter. So you've got the space which melasma does not affect. It affects women much more commonly than men, but certainly men do get it. But women, it's because of hormones. The other hallmark of melasma is that it usually worsens in pregnancy. So that's number one thing which I ask women. Secondly, hormones, for example, being on the pill can actually make it worse. And there's often a fluctuation, which means it gets worse in summer and usually improves in winter. It's because of the UV index. In Brisbane, where I live, it's super common. Like seriously, it's super common. It's probably 1 in 10 women have this condition. It is one of the harder conditions to treat, but certainly it is treatable. Now, how I approach this is that the first and foremost is sun protection. You've got to actually have sun protection. And by sun protection, I mean hats, yeah? Hats, really broad-brimmed hats, not caps, hats, together with sunscreen. Sunscreen twice a day, once in the morning and once at noon. And I prefer a broad spectrum sunscreen, preferably physical base. So something like zinc oxide or titanium dioxide, but certainly stuff like Merxol XL from La Roche-Posay, one of my favorite sunscreens. Now, sun protection is the first and foremost. Secondly, I use something called a tyrosinase inhibitor. And they may use something like Meloderm or hydroquinone, and that's got to be applied as tolerated. Start 3 nights, go up to 6 nights a week. If you follow that, you're going to improve some of the pigmentation, but the trick is to actually use lasers. And the laser which I use preferably is what's known as a Q-switch laser. So a Q-switch laser is a low dose laser. So there's no chance that your melasma will flare up, unlike using fractionated lasers. So yes, I realize Clear and Brilliant, Fraxel, they're great lasers, but all of these lasers, fractionated lasers, can actually flare melasma. But if you use what's known as Q-switching, it can actually improve melasma, but also firm up your skin. So I use lasers in conjunction with creams at all times. It's never about the laser, it's never about the cream, it's about the combination. Occasionally I use something called tranexamic acid, which is basically what we call a VEGF1 or vascular endothelial growth factor 1 modulator. And that can help with melasma. So look at a couple of cases here and we'll study them carefully. Chemical peels can be a useful way to treat melasma. However, this is of historical value only. These cases are done well over a decade ago, but you can see the effectiveness of TCA peels or medium depth peels together with creams. They're an excellent way to treat sun damage. That's TCA peels. Nowadays we've replaced it with lasers. So using what's known as Q-switching, which is low fluence or low dose lasers. And this is the before and afters together with using tyrosinase inhibitors. They're a predictable, safe, effective method for the treatment of melasma. And it can also be used to treat certain forms of sun damage together with melasma. So this is the before and these are the afters
It's about 10 weeks between the intervals. Now, using newer technologies such as picosecond lasers, we can get this amazing result, especially in ethnic skin types. Study carefully the wrinkles as well as the pigmentation. We get an amazing improvement using picosecond lasers. Once again, they've got to be in context with the skin type of the patient, and this is all off-label use. So, picosecond lasers, nanosecond lasers combined with creams, we can get a good improvement with melasma in 95% of cases. And the great thing about it is that there's no chance of worsening the pigmentation. And once again, for treating even rebound pigmentation or post-inflammatory hyperpigmentation, these lasers are excellent.
Now, living in Queensland, the second most common cause of facial pigmentation is due to, that's it, sun damage. So sun damage often is complex because it's not straightforward sun damage. In the majority of cases, well, I won't say majority, probably about 40% of cases, we have an element of melasma, especially in the younger population. You have an element of melasma which can easily be confused with sun damage. If you use older technology such as IPL on sun damage, that can work really well. But if you use that in the patient who's got a tiny bit of melasma, you'll treat the sun damage, but you will flare up melasma. So it's one of the common flare-up factors which I see. It's called iatrogenic, in other words, induced melasma, and that's due to IPL. So let's talk about sun damage. Sun damage usually presents differently. It usually hasn't got the characteristic pattern which it has with melasma. It hasn't got the seasonal flux, compared to melasma, where it's often worse in summer. And the sun damage is more discreet. In other words, you can actually draw around it rather than a mottled appearance which you have in melasma. Sun damage is super easy to treat. I use everything from Q-switch lasers all the way to Fraxel. In fact, Fraxel is probably one of my favorite lasers for treating sun damage. You only need one treatment and the downtime is about 6 days or so. So depending on the amount of pigmentation you have due to sun damage, I use things like, for example, pico lasers, Q-switch lasers, fractionated lasers, all the way to fully ablative laser resurfacing. Now, fully ablative laser resurfacing has got a downtime of about 10 days, and you're red for about 3 months, but that's a big guns, and I normally hold that for, really bad sun damage.
So I use fully ablative erbium and also CO2 lasers for treating sun damage such as this, because it gives a remarkable result both in pigmentation together with the reduction in wrinkling. So we'll see another case shortly of marked pigmentation coupled with wrinkling, and this is one treatment and one treatment only, but it is serious downtime with this.
The third most common cause of facial pigmentation is post-inflammatory hyperpigmentation, or PIH. As you guys know, PIH is one of the hardest conditions to treat. The reason being is that you can't hurry it up. Any laser aimed at treating PIH has got to be low and it's got to be slow. You can't actually use, for example, an ablative laser to blow up the pigment, because all your skin's going to do is it's going to actually rebound back. It's going to send more pigment up to your epidermis and your dermis, and you're going to get a longer prolonged PIH. So you're going to get PPPIH, prolonged post-inflammatory hyperpigmentation. So PIH due to acne, chickenpox, dermatitis, eczema, any one of those conditions, it's going to take you at least 6 months, and in some cases, especially in ethnic skin types, Asian skin types, Mediterranean skin types, and certainly South American, Central Americans, it is going to take anywhere up to 12 to 18 months before resolving. Time and sunscreen is going to be your biggest friend for treating PIH. Lasers can certainly help it out, and in this situation I use pico lasers or nano lasers. So PIH is number 3.
So guys, I'm using Pico, so Pico Sure Focus for acne scarring. This is my favorite setting for treating certain scars in ethnic skin types. It doesn't work well on fairer skin types, but for ethnic skin types with this particular type of scarring with post-inflammatory pigmentation, it works really well. Here is the Pico Sure. It's firing at 10 Hertz. I'm using 0.71. I'm listening to the laser, so it's called a photoacoustic laser. You hear that ping. As soon as you hear that ping, we release the melanin. It also gives a shockwave effect to actually do what's known as a spring effect. In other words, it remodels collagen. because of the sheer energy of this laser. So it works by LIOBs. It stands for laser-induced optical bodies, which is basically the melanin being shattered, which releases the growth factors. But also just the sheer strength of this laser at this wavelength will also stimulate collagen. So excellent for ethnic skin types.
In the context of PIH secondary to acne, certainly lasers can help, but I have to use many other procedures including subcision, dermal fillers and many others to achieve this result. PIH due to IPL burns can also be treated with lasers. This is the before and after 5 sessions, 10 weeks later. Now, acne scarring should not be confused with PIE, or post-inflammatory erythema. This is redness, and this has to be treated with vascular lasers. So understanding which type of pigmentation is vital to getting results.
The fourth case of pigmentation which I see most frequently is due to genetics, and that's due to either freckling. Freckles are pretty easy. I mean, man, you've got them as a kid, so you know what freckles are, yeah? We can remove them, but guess what? They'll always come back. It's 100% chance that freckles will come back. So we can use everything from IPL all the way to Fraxel laser, or you can use IPL with Fraxel, something I call pulse Fraxel. Generally speaking, with pulse Fraxel, you need one treatment and 80% of your freckles will go. If you maintain that with things like AHA creams and vitamin A tretinoin, you're going to get about a year or two out of it. That's providing you keep out the sun. Okay, so that's number 4. Number 5, birthmarks. I see realistically probably 4 or 5 per week, at least one a day. Okay, so the most common brown birthmark or hyperpigmented birthmark I see is something called a CALM, C-A-L-M. For those of you who don't know what a CALM is, it's called a cafe au lait macule. The great thing with CALMs is that if it is diagnosed correctly, you have got an 80% chance that a laser can actually help. And the laser of choice is just realistically an old-fashioned Q-switch laser will do it. So you don't need to go for those fancy pico lasers, which yes, we do use, and it is one of my favorite lasers for actually treating pigmentation, especially in ethnic skin types. But for CALMs or cafe au lait macules, you only need the old-fashioned nano lasers. So things like C6, Revlites, they all work fine. So that is super common, well, at least in my books anyway, but that is another form of pigmentation. So guys, I hope you found that useful. I do one video every Saturday morning Brisbane time. So this is an interactive channel and that's why it's growing so well. So guys, please by all means subscribe and by all means chime your thoughts below in the comment section. If you like this, please like it, share and subscribe. I'll see you same time, same place next week. Bye.